One of the things that we are hearing from patients most often right now is a concern about having to go back into the workplace during COVID-19. We're also hearing that concern from caregivers who are caring with someone with a cancer diagnosis and a compromised immune system. And so there are different rights for employees who've been diagnosed with cancer and caregivers. But in the context of the pandemic, really the biggest concern is how do you stay safe as an employee? There are federal, state, county, city protections that have been created as a result of the pandemic to make sure that workplaces are safe. So things like wearing masks and social distancing and hand sanitizer and all of the things that we've heard be talked about. But if there isn't a way to make sure that that workplace is safe for someone with a compromised immune system, they may qualify for some of the legal protections under the law, like the Americans with Disabilities Act, which can protect people against discrimination in the workplace based on their medical condition, but also give them access to reasonable accommodations. And generally, when we're talking about this with the cancer community, things like telecommuting, or changing your schedule or your work location, where maybe there are fewer people working in a particular office than in a larger office. Those could all potentially be reasonable accommodations. So that's where we usually recommend people start to see if there's a way that an accommodation could be helpful. But if someone has the type of job where maybe telecommuting isn't reasonable based on their job responsibilities, and they decide that they really don't think it's safe for them to be in the workplace, then they can consider taking time off and looking at the laws and programs that provide that ability to take time off, protect someone's job and their health insurance coverage. And the federal example of that would be the Family and Medical Leave Act, or the FMLA. But there are also state, county, and city laws that provide the ability to take leave. And so depending on where someone lives, they might have access to some of those additional benefits. And then if someone is needing to take time off, how do they replace those lost wages if that leave is unpaid? So maybe they would actually qualify for disability insurance based on their medical condition, and where they live and the state that they're in can also change which benefits they have access to. So then looking to see what those wage replacement options are. And then ultimately, if those aren't available to them, if they decide not to return to work and accommodations aren't an option and none of the other things that I've talked about apply, if they go back to work or if they decide not to go back to work and their employer lets them go, then they could look at unemployment benefits. Our goal is to provide as much information as possible for people to avoid that situation so that they understand all the opportunities available to them before getting to that point where they might lose their job.
But certainly if they do end up in a situation where they've lost their job, we also want people to be thinking through what their health insurance options are and what the best option for them is. And so we provide lots of resources on the Triage Cancer website to help people identify their various options, but then also learn how to make choices between those options. So talking about how to do the math to figure out what the plan is actually going to cost you for the year, and to check the networks of providers and to check the prescription drug coverage. Because we want to make sure that even if somebody's lost their job, they're still going to maintain the best health insurance coverage possible for them.